Everyone realizes the serious health problem we face in the U.S. and around the world when it comes to the obesity and diabetes epidemics. Researchers are constantly looking for the best ways to curb these epidemics and slow down their devastating effect on our healthcare systems. Most researchers now agree that the main reason we are facing these problems today is because of our poor lifestyle habits. The lifestyle habits that are creating these problems are primarily a poor diet and lack of activity. We are simply eating too much in the way of processed foods, sugar, and what we refer to as high glycemic carbohydrates, as we have also developed sedentary lifestyles. However, researchers also realize that one of the greatest challenges in medicine today is being able to be effective in helping their patients modify their behavior and firmly establish healthier lifestyles. Even though we are spending over $30 billion each and every year in the U.S. alone on diets and weight loss programs, the number of individuals suffering from obesity and diabetes continue to rise. Dr. Thomas Wadden and his group reviewed over 3,000 abstracts and 14 clinical trials between January of 1980 and June of 2014 that recruited overweight and obese patients and provided behavioral counseling for at least 3 months. Their findings were reported in the November 5, 2014 Journal of the American Medical Association. They established criteria as to intensity of the counseling, follow-up, and physical measurements. They were able to conclude that the weight loss the participants were able to achieve was increased with a longer follow-up, greater than 12 months, more treatment sessions, either in person or over the phone, treatments that included both calorie restriction and increased activity or an actual exercise program. When these criteria were met, the patients had a very good chance of losing at least 5% of their body weight. It is important to realize that when an individual is able to lose 5% of their body weight or more, that they also have significant improvement in their health parameters like their blood pressure, cholesterol, and triglyceride levels. Blood sugar levels come down, and the list goes on and on. However, the critical point of this entire review article was the fact that no one received this behavioral management support through their physician's office. This was all done by trained interventionists who were primarily non-medical individuals. The reason this is important is the fact that physicians are simply too busy to become involved in behavioral changes in their patients, even though clinical trial after clinical trial demonstrates that this is the key necessary to having success with weight loss and improved health. This leaves a major void in our healthcare system. Physicians are basically disease-oriented and drug-oriented. When they don't have a drug to prescribe for a particular problem like obesity, they pretty much don't do anything. This leaves a great opportunity for anyone who wants to become involved in the health and wellness industry. RX provides you with the products and expertise to pursue this opportunity to whatever degree you choose.